We're live at the Midwest 340B conference, and we're here with Brenda Reitz from Family Health Services of Darke County. And we wanted to talk a little bit about some recent events you've had at your health center and how you're promoting your pharmacy.
Thanks for having me, number one. We've had some really good success, and a lot of it was just, I'll speak about on the first event we had for our 20th anniversary for our pharmacy. It kind of was during COVID, I think coming out of COVID, and it came upon us like a 6 weeks notice. We were like, oh, we really should do something with this and have a celebration, especially to celebrate not only the pharmacy, but actually people being able to be out and about again. So luckily, we just kind of started throwing a lot of things out to see what would stick. It was just a couple of us working on it. Mm-hmm. At that time, I had a great tech who had some marketing experience, and she was a go-getter, so she took on going to all the local establishments and just asking for free stuff. Nice. It's like they could just say no, because we wanted to have a lot of raffles to bring people in, because I think everybody knows if you're going to have an event, to bring people in, you have to offer something. You have to have giveaways. Even though my current CEO kind of wanted to keep everything classy for this most recent one, it's like that's not going to work because you won't have anybody show up. So we did. We threw this together, and my kind of role was working on the advocacy side and to try and pull in as many local and state, and we asked for federal representation from legislation to come join us. And there again, all you have to do is ask. They can always say no. So the thing I recommend to any facility, because I did not have any direct contacts, I'm not high in any party or anything like that, put a word out to your facility. Somebody knows somebody.
Especially at the state level.
Yes, at the state level,
yep.
Local level, state level. And so we were very fortunate that our dental director had very close ties to one of our state legislatures. And so we kind of had an extra in. But I just went onto the websites and sent actual emails to the staffers. I found out who the staff was. So you get further if you send the message and invitation to the staff. I made out a little explanation of 340B and our pharmacy celebration and what we did for the community, and asked them to participate and come, and I offered them to be able to speak or share their views. And we actually had 3 state representatives come, and Senator Lips wasn't even our representative.
Yeah,
that's fantastic.
He was just very active in the 340B program. I actually got to go on site for your 20th anniversary, and Felicity's left out.
Yes,
but it was great because you had all these community members, and you had food trucks and DJs.
We had a DJ. We had face painting for the kids. We had free popcorn and cookies, and the food trucks, and we gave vouchers for our employees so that they could celebrate as well.
That sounds amazing.
So that one was a really good success. That came together very quickly, and I was able to talk, kind of maybe my first venture into speaking off the cuff, because we had a local news station there, and it got the word out in the community about our pharmacy that a lot of our community doesn't even really know exist, because if they have to go to the big boxes and they go to their doctor and then immediately leave, they didn't even really know we were there and what services we offered. I also then, that kind of triggered going to our local radio station. I've been there twice to talk about all the services at our family health center, and the host had no idea what all we did to provide service to the community. So
I think that's great, because you're bringing the real life story of 340B, and we don't hear the good things very often. So bringing it, advocacy is more than just talking to legislators. It's also talking to community and educating your community.
Yeah.
So I think that was a great way to do it.
Yeah.
How did you like that radio experience?
It was, well, it was fine. It wasn't near as intimidating as this because I wasn't on camera, but no, it was good. It was, just a short spot, but it was really nice to highlight it, and I felt good afterwards, and that we were sharing our story, and that's truly the thing, is just sharing your story.
I have a habit of pulling Brenda out of her comfort zone and
Yes.
encouraging her to do new things,
Yes,
like
yes.
speaking at conferences and
Yes.
doing podcasts.
Yes, I get to blame Logan for anything I'm involved in anymore, but no, it's a good thing. It does, because I do like to share our experiences and our successes as well as our barriers that we've had to overcome. And so our most recent event, we had an expansion, and we were able to add on a whole 2-story wing to our facility. And we brought back home, essentially, our behavioral health unit, our WIC, our home health care under one roof. We expanded dental by double. And then we moved our pharmacy from the middle of the building to the end of the new wing and added a drive-through to help better serve the community.
Everybody loves a drive-through.
Yeah.
Except
Except for pharmacists. Yeah. Except I finally was like, oh, okay, after COVID and having to, because we maintain curbside
That changed
delivery.
everything.
And if I'm going to send my people out in the rain and the snow, I might as well have a drive-through.
Yes.
So just recently, that was happened on August 7th.
And you
And-
had legislators there again for that.
Yes,
So
and the difference with this event versus the pharmacy one is we were blessed to just 3 months ago, the CEO realized the value of advocacy, and we just I couldn't do it on top of everything else efficiently. And so we did hire an advocacy and promotions person who really took the lead, and we had an amazing event. I was pleasantly surprised. There again, we invited the legislators. We had two state senators there. We had the local Darke County commissioners
Nice.
there, and then the ones who could not attend because some already had obligations. We also got the what do they call letter of
Commendation
commendation letters.
Phenomenal.
And then there again, we got exposure to what all we do for the community through the newspaper, and I think Channel 2 News was there. And there again, we had things for kids. So we had face painting, bouncy houses, again, popcorn and ice cream, and then we had it catered. So we had small hors d'oeuvres for everybody, and they actually ran out of food, so we had a really good turnout. And then all of our different departments, and then set out a table in our new community room. And so they did just like they do at conferences. We did a passport. So if they had to,
That's a
so
good
they
idea.
had to hit. We had our stamps and they had their cards, and if they hit 6 of our departments, our tables, and we had free giveaways at those. We gave away pill boxes, and other people had, all these different, swag. And so if they hit 6 of them, they got into the main big raffle drawing, which was this great big basket of prizes. So like I say, we did it from. We did tours to the legislatures and any of the other people who wanted to attend. So we took them all around and got to kind of talk about 340B, took them in and talked about the challenges we were having. And then we also opened it up to the public, not everywhere, but into those community rooms, and were able to share and then gain stories and hear how people were thankful that we were here and able to serve them.
It's amazing. Now, Brenda, did you, when you were a little girl, realize that you were going to be such an amazing pharmacist advocate when you grew up?
Not at all. Not at all. I was a dispensing staff pharmacist, and then I moved into management my whole history had been at the retail level. Yeah. So until I came to, Family Health Services, covered entity, it was like my dream job because of the hours. And then I didn't realize, I think, like everyone else, you don't realize what community health centers do and all the lives they touch. And just being able to have that sense of, this is what I went to school for. Yeah. I went to school to help people, and I can have I had a direct impact before, but I had more control over financial abilities to give people access to medications.
Yeah.
And so that really was life-changing.
I think that's a lot of our story is coming from retail experiences, and then we find out what health centers like and what all we can do for our patients.
Yeah, I came from the hospital space, and when I switched, I'd been working in cardiology forever, and just seeing the same thing over and over, and just wanting to get upstream and be able to help people before they got into that critical position. And being in the community health centers, there's just so much you can do to help prevent beforehand, and it's just amazing to hear all the things you all are doing at Dark, Brenda, and just letting the community know, because I think that is such a big opportunity. I know with our health center, it was started with removing the stigma, right? Encouraging everybody to know that this was a resource, not just for a certain group of people, but for the community.
A lot of people think it's the free clinic or anything, so getting that...
But we provide great care.
Yeah, and for anyone, it's health centers...
And in our rural area, we are the only health center. I mean, we are the only providers in our whole county. So we do serve the most affluent and the ones who need it the most. And they're all treated equally.
Which is amazing.
Which is really good to see.
So important.
Yeah, and I know you have some great news that you've got a new pharmacy coming on board. And
Yes, so we have been busy. We had our remodel for our current pharmacy in our main location. So that move got done, and we will be opening, we are opening our second location in our next town over, still within Dark County, in Versailles, Ohio. So we are opening that. It should be officially open. I'm not going to say it on air because I don't want to jinx it. Soon. Soon. We are doing a soft opening, and we're working out all the kinks. And then as soon as that opens, I'm opening a third, and that construction is already done in another location. And Logan's going to have to help me through that process all over again. We get through one, and we're just starting on another. And hopefully we just don't stop. We also added specialty accreditation.
Amazing.
We just got our second accreditation. We have ACHC and now URAC. Just got approved last week, and so we're just trying to diversify with all the things in 340B. You just never know, so we're trying to be innovative and get ahead of the game and be prepared to make some pivots if necessary.
And more importantly, you're providing that access to those patients in rural areas so they don't have to drive to Cincinnati or Columbus, and they can get care close to home, which is really important.
Yeah, so now we have been able to partner and be able to bring those specialists into our facility on site and telemedicine. And it's, like I say, literally people went untreated because they did not have transportation to get to those larger areas. We're an hour away from any other major specialty groups. So it has been life-changing, and it's really neat to have those stories shared as well.
Yeah, it's really clear how your passion and enthusiasm has helped develop the 340B program in your organization and the impact that's bringing to your community.
So thank you.
What points of pain points or points of advice would you give to somebody that's trying to get these community events to really educate their community about 340B?
Okay, definitely is ask for help. You can't do it alone. I mean, you need to delegate and reach out, because there are some people out there, within your facility, maybe not your pharmacy, but somewhere in some department, love these things, love party planning, love to do that, stuff that I would like, okay, you take care of that, So just ask. Ask for those connections to, local, even the mayor, the sheriff's department. Get them involved, because then it kind of spirals, and then other people bring ideas, and just roll with it. I just don't be limited by what you think you can do. Just assume that it will happen, and just like build it, they will come. I think I did that session name because it truly. I mean, if you dream it, it can happen, but not doing it alone. And asking for support.
Yeah, and I also think you said food as well.
Yes,
that seems to be a key.
Food and free stuff and food will definitely drive in, and stuff for kids. You need to have something for those kids to do, and then that's going to bring the parent in. Oh, I didn't know you can provide WIC services. I didn't know you could provide. I could get my antibiotics
and Brenda,
affordably.
I'm going to pause you for 1 second in case people aren't familiar with WIC.
Oh yes. It is what is
women, infant, and children.
Children, yes, thank you. I was like, I don't know, it's just WIC. It's where you we provide support for pregnant and nursing mothers to provide food, breastfeeding assistance, and just that support for those families.
And I know my health center was the WIC provider in some of our counties as well. So it's somewhere where health centers are really integral, but being able to provide that integrated whole person care, you're not just taking care of one part of the person, it's the whole
The whole person from infancy to nursing home is
Wow.
able to, our span of scope of service.
That's phenomenal.
So I think that's really great, and I would say I would encourage anyone that is opening a pharmacy or a new health center site, have those community events, have a
Celebrate.
open ribbon cutting. That's a great way to educate your community about 340B and about pharmacy and about health centers.
Yeah. Thanks for sharing your story with us, Brenda.
You're welcome. Thanks for having me.